Hello, everyone. My name is Noah. I'm the communications coordinator at Voices for Vaccines. This video kind of continues our series on basics of vaccination and looking through different subjects on vaccines from COVID to routine immunizations, kind of taking some questions you gathered from you in social media and trying to give some very clear answers. Today, I'm talking to Dr. Gretchen LaSalle, who is a family physician in Spokane, Washington, and with over 20 years of experience. She graduated from Tulane University School of Medicine in 2001 and completed her residency at Oregon Health and Science University. Dr. LaSalle is the author of Let's Talk Vaccines, a clinician's guide to addressing vaccine hesitancy and saving lives. And she is a longtime vaccine advocate who urges a compassionate, evidence-based approach to persuading patients. Dr. LaSalle, welcome.
Thanks so much for having me. It's good to be here.
So today we're going to be talking about routine immunizations, kind of going through not just every specific vaccine, because you can get that from the CDC website, but really kind of specific vaccines and some common concerns that people have. Before we do that, I want to ask a question that's less about the vaccines, I guess more about you and kind of your enthusiasm for them. So you're somebody who is very strongly pro-vaccine. You describe yourself as a semi-obsessed vaccine advocate, which is awesome. I wonder if we could kind of start on a broad scale and just ask, why are vaccines so important?
So my passion in medicine is preventive care. I'm a family physician, so I take care of people from birth until old age and all phases of life in between. And my goal is to keep people healthy and not have to deal with disease on the other end. And our greatest preventive care measure that we've ever had is vaccination. Vaccines have prevented millions and millions of deaths. And death is not the only outcome. There's, a lot of morbidity is the word we use in medicine, other negative effects of vaccine preventable disease that we can prevent. And so that's kind of how I come to this passion of mine. And I got started in this work because I was starting to hear an increasing amount of hesitancy in my own patient population. I live in the inland Northwest. And so this area, it's relatively common. And I think just in the time that we live in with the advent of social media and the internet and information that gets spread with a click of a button, I was hearing a lot more questions and concerns and just bad information out there. So I wanted to be able to share what I know and the work that I've done with as many people as possible. So thank you for this platform. I really appreciate that. There are so many vaccine preventable diseases we're all familiar with growing up, getting our own vaccines as kids. Right now, it feels like COVID is everything, but there's a lot more out there that we need to keep mindful about, because if our vaccination rates drop or we don't bring them back up, because COVID has impacted our routine immunization rates, we can start to see the return of some pretty devastating illnesses. So I'm glad to be talking about something other than COVID today. So thanks for that.
And that's, important subject to talk about. Obviously, like you said, there was a drop in routine immunizations, probably more so due to, access and people not being able to get appointments and things like that.
Yeah.
But, even so, it's still good to understand why these vaccines are important and kind of clear up some things that might be stopping people from going to get them. So we don't have to go through every single vaccine, like I said, but I did want to go through some of them and kind of in the process address some broad concerns that we might see along with those vaccines. So I'll start with the vaccine itself and just ask you maybe to, if you were talking to a patient or somebody in the clinic and how would you walk them through, and then we can go through some specific questions. So the first one I just want to ask generally about would be the MMR vaccine, which is measles, mumps, and rubella. If somebody had missed that vaccine and they maybe were a little bit, not sure if they should get it or not, or if it was worth it, how would you kind of convince them?
Well, so, thankfully, a lot of these vaccine preventable diseases we don't see in our day-to-day world, and that's because of the success of our vaccine programs. Measles specifically is if not our most contagious vaccine preventable disease out there, it's right up at the top. One person can infect up to 18 other people, and it can linger in the air for hours. You don't even have to be in the same room with a person who had measles. So it's highly, highly contagious. And it takes a large amount of people being vaccinated in the community to keep it at bay. And we actually saw back in 2017, 18, I think it was, a return of measles in the United States, but really around the world. There were over 140,000 deaths from measles in 2018 worldwide. And it's a very serious disease, not to minimize mumps and rubella, but measles is kind of the scariest thing that we have out there that can return if we don't keep our immunization rates up. 1 in 4 people will get hospitalized with a measles infection, which is a pretty hefty number, and 1 to 2 out of 1,000 will die with measles. And it largely, those really negative impacts largely affect children under 5. And one of the things that we don't hear as much about is that, a small percentage of people who survive measles will develop a 100% fatal neurodegenerative condition called subacute sclerosing panencephalitis. I know I just said I didn't want to talk about COVID, but I'm going to jump over for a second to say, or I was excited to not talk about COVID. I'm going to jump over for a second to say that this is one of the things I talk about when I have patients who are like, we don't know about this vaccine for COVID. What's it going to do to us 10, 20 years down the line? And I use measles as an example. I mean, we have had vaccines for decades, and our COVID vaccines have been made much along the same lines as every other vaccine that we've had. So we have really good data showing that there's not adverse outcomes from other vaccines decades later. But what does happen is adverse outcomes from the illness itself, like this subacute sclerosing panencephalitis or HPV and cancers decades later. And so I use that as an example, not only to emphasize the importance of our routine measles, mumps, rubella type immunizations, but to emphasize the importance of preventing vaccine preventable disease, because it can impact us many, many, many years down the line. And we don't know what COVID's going to hold for us in that regard. Sorry, I got off on a tangent for a second there.
All good. It's important to hear.
Yeah.
We were actually just talking about that on the last video we did with Dr. Huang, where they were looking at for COVID specifically. I mean, you have cardiac outcomes for even mild cases a year out that are elevated in all sorts of different problems that people are having. So viruses do that. I mean, flu, even we're still working through the long-term implications. There's a lot of unknowns to it. A concern. So this is not specific to this vaccine. This is a concern that people just have kind of generally. This is a vaccine for 3 diseases. And, kids, when they're younger, do get a lot of vaccines because there's a lot of diseases to prevent and, all sorts of things to protect against. But some people kind of expressed concern that, maybe having too many vaccines or facing, too many antigens for diseases might kind of like overload your immune system or be too much for a kid or even an adult. So how would you address that concern?
Well, so our bodies are meant to deal with assaults from viral proteins and other antigens, and if we weren't developed to deal with those and to handle those, we wouldn't really survive childhood very well. So our children's bodies, while they are relatively delicate, are pretty strong in the immune response, and they can absolutely handle 3 or 4 vaccines, which is pretty common for us to give all at one time in a routine immunization series. So they're absolutely equipped to do that. If you think about kids, your average little kiddo is crawling around on the floor and sticking their hands in their mouth constantly. So they are exposed to so many more immune stimulating proteins on a daily basis than they get in any series of vaccines. So that's kind of how I talk to parents about that concern. Our kids are strong, and they're, evolutionarily speaking, we're developed to be that way because that's how we've survived as a species. So.
Absolutely. And actually, we're writing something about that just now. There's a lot of interesting facts where, from the moment a child is born, they're facing millions of microbes, right? All sorts of things which are foreign to them, and kind of very quickly the body is developed to kind of fight those things off and even learn from them, right? Which is exactly what a vaccine is doing. So
yeah, and I'll say, people will say, well, that argument could be used to argue that we should get the illness itself, and the kids could survive the illness. Why use a vaccine? Why not get a natural immunity? And the answer to that is really just that, vaccines introduce the body to a protein that's going to trigger an immune response in a safe and controlled way. Yes, the same thing happens with a natural illness, but the natural illness is not controlled. In fact, it's a pretty uncontrolled trigger to the immune system. And we see really serious outcomes of disease. And so we want to prevent those serious outcomes while giving the body that little glimpse into the illness that will help protect it for future encounters. And that's what a vaccine does, is introduces the body to that virus or that bacteria or that toxin in a safe and controlled way.
Great way of putting it. The next vaccine I did want to ask about was the Tdap vaccine for tetanus, diphtheria, and pertussis, which is usually called whooping cough. Could you, first of all, before we kind of dive into anything specific, just kind of talk about the importance of this vaccine? What does it prevent, and why is it important?
Tetanus, I think we're all relatively familiar with tetanus. You step on a rusty nail, you get a tetanus infection, and it is highly deadly. I mean, we vaccinate both for things that are hugely contagious and maybe not, we might survive, but they're very contagious, just so to limit spread of disease within a community. And we also vaccinate against things that are highly deadly, because if you get it, you're most likely to die. And that's what tetanus does. There's really not a lot of treatment, successful treatment options we have for tetanus. So tetanus we give every 10 years because the immunity of that wears off over time. Diphtheria is an infection that can infect the throat and cause swelling and closing off of the airway, and that's how it kills its victims. And again, I've never seen a case of diphtheria. I've never seen a case of tetanus, thank goodness, because we've vaccinated. And then pertussis is whooping cough, and we have outbreaks of that every year, and it can be highly deadly for babies. And so for the rest of us, we survive it, but it causes what's sort of affectionately called the 100-day cough. I mean, it's a cough that lasts and lasts and lasts, and it's hard enough that people vomit afterwards. It's hard enough that they break ribs. It's really impactful, even if it doesn't kill you. So it's very worth preventing. And we vaccinate in pregnancy, our pregnant moms with the Tdap at the end of their pregnancies to protect the baby, because babies they can't get that pertussis vaccine, or that for children, it's called Dtap. They can't get that at birth. They have to wait a couple of months to start that series. And in that time, if a baby gets exposed to pertussis or whooping cough, it can be deadly. So we vaccinate mom to pass protective antibodies to the baby. And then we try to vaccinate everybody around that baby, create that protective bubble for that high risk infant. And so it's really important that everybody stays up, on their Tdap vaccines. Adults tend to kind of think that vaccines are something for kids, and that they did that, and that there's not really much left to do as an adult, but we do have routine immunizations for adults. So again, being a family physician, I'm talking about vaccines across all stages of life. And so we do a lot of adult vaccine discussions, and Tdap is one of those.
Great. And so you touched on this a little bit, but kind of a question that goes along with it, and sometimes I get. Whooping cough is obviously very common, or fairly common. I mean, among the vaccine preventable diseases, certainly one of the more common ones. But obviously, diphtheria and tetanus are pretty rare, especially in the United States. So what would you say to someone who says these diseases, I mean, obviously they're terrible diseases. I think, people get that, but they just aren't common enough to vaccinate against. I mean, what would you kind of say to that concern?
Tetanus, I mean, we don't see it because we're vaccinated. It's tetanus lives in the soil. It's everywhere. It's not something that's passed necessarily person to person. So, we don't see a lot of tetanus because the large majority of us are vaccinated against tetanus. Diphtheria, we don't see that because of vaccination as well, but that is much more highly contagious. I kind of lost track of your question as I started answering. Remind me.
Oh, good. We're just wondering. I mean, some people say I'm not going to get diphtheria or tetanus. It's so rare. So what would you say?
Yeah. So tetanus is a little bit of a different animal in that discussion, but really we vaccinate against things that we continue to vaccinate against, vaccine preventable diseases that we don't see as much anymore because they can make a comeback. Because our immunity wears off over time for many things. We're learning this with COVID, of course. If we don't maintain immunization rates, and to a large enough degree within the community, then these things come back. And can be pretty devastating. So we use the example of measles, mumps. When here in Washington State, before the measles outbreak by a couple of years, we had a mumps outbreak. And so we've seen over time, and what's worried me, and again, part of why I got into this work, is that we've seen immunization rates drop a little bit year over year in the recent past. And again, with COVID, it was very much sort of an access issue. A lot of physicians' offices were closed, or people didn't feel comfortable coming into the office. And so those routine immunizations kind of fell a little bit by the wayside, and we're trying to catch up and make up for lost time. But a 15 to 20 to 40% drop in immunization rates is really worrisome. Measles, for example, needs to be 95% of the community needs to be immunized against measles in order for it not to come back. And we were already skirting, a little bit below that before the pandemic. And so we really need to stay vigilant about our routine immunizations and getting caught up. If you're not sure if you're due for something, I encourage you to call and check with your clinician's office, and they'll tell you, and get caught up on those vaccines, because they're really, really important. We've had enough living with COVID and in the pandemic of COVID. And I don't want to see anything else come our way. We're pretty exhausted. I don't think we can handle it. So.
Right. No, absolutely. And that, I mean, that's a great point as well. I mean, like, if somebody doesn't see, the value in the vaccine, I mean, this is the time where it's most important, right? Where the immunity is dropping. I mean, you might actually see a very direct need for it if there's an outbreak. So that's definitely worth pointing out. Kind of with the flu vaccine as well. I mean, some people say, I don't get the flu that often, or it's rare or whatever, but one of the reasons you don't see the flu as often as you could is 60% of people get vaccinated, right? Which stops transmission pretty significantly. So there is that kind of working in the background effect, right? That very much is a product of these vaccines. So the next one I want to ask about, or next set of vaccines, are the vaccines for hepatitis, which we vaccinate for A and B. And so I want to ask first just about those vaccines in general. I mean, I don't think people know too much about hepatitis, although everyone's hearing about it now because there's that recent outbreak. But why do we vaccinate against these diseases? Why would you recommend this?
So hepatitis A and B, both are liver infections. And hepatitis A is more of a food and waterborne illness. You get it from contaminated food or water. And we don't see it as much in the United States, but we do around the world. It doesn't usually cause death, but it can make people really, really sick. And so we want to, of course, prevent illness. And, as we get older, if kids nowadays are immunized against that in their routine series of vaccines. But as adults, if we haven't had a hepatitis A vaccine, if we're planning on doing any travel around the world, hopefully getting back to that someday soon, it's an important one to have because getting really, really sick in another country can be not a good deal. Hepatitis B is something that is a blood and body fluids transmitted liver infection, and it can cause long-lasting disease, liver failure, and liver cancer, and death. And so, initially in the hepatitis B immunization efforts, people first started trying to immunize those who are at risk. But people who are at risk of hepatitis, it's hard to look at somebody and say you're at risk, and it can be transmitted, through casual contact. It doesn't have to be intimate contact, using someone's toothbrush, using someone's razor, a baby getting bitten by another baby in daycare. And the reason we immunize infants for hepatitis B, even though their exposure to blood and body fluids is relatively low, is to protect others. We found that immunizing children at a younger age protected the larger community much better from Hep B than immunizing adults who are at risk. And also babies who get infected with hepatitis B are much more likely to become chronic carriers of that illness and then to develop that liver failure, liver cancer, and for it to end their lives prematurely. So much more likely than if they got it as an older child or adult. So that's why we immunize in infancy for those things. We don't see as much of these here in the US as we do around the world. But again, we are a really small planet. I mean, people travel, we cross borders, and viruses and illnesses don't respect boundaries. Or borders. So we have to think of ourselves not just as the United States, but as a global community. And until we have things eradicated globally, we have to remain vigilant here at home as well.
Gotcha. Great. I was going to ask about Hep B, where you talked about, some people have the perception that, I'm not going to get it, but there are easy ways to get a Hep B. For Hep A, I mean, it's a very contagious virus kind of in and of itself. It's also one that can be spread through kind of, unhygienic conditions, through like waste, for example, or sewage. So, some people say that, it's not the vaccine that's helping, it's hygiene. What would you say to that? And then people use this for all sorts of vaccines, right? To say, it's not the vaccine, it's just, things are more cleanly. So how would you respond to that concern?
Yeah, I think we tend to look at things in this black and white way of thinking. And in this situation, I think it's not either or, it's not hygiene or vaccinations. It's both and. I mean, both are really important. Hygiene has absolutely, and water sanitation and all that has absolutely played a critical role in public health and keeping people well. But despite that, things still spread. Not everything is waterborne or foodborne, and a lot of it is respiratory droplets. In the case of Hep A, that's different. But for a lot of these vaccine preventable diseases we're talking about, it's respiratory transmission. And so hygiene, as far as hand washing and that sort of stuff, helps, but it's not the only intervention that we need. And vaccines have proven safe time and time again, highly effective at doing their job. And so it should be a partnership, not a one or the other type of scenario.
Great. Okay. So I have two more kind of routine vaccines that I want to go over specifically. And the next one, I think for me, I mean, this is an extremely important vaccine and there's a lot of misconceptions around it, which is the HPV vaccine. And, this is a vaccine which quite literally does prevent, if you vaccinate a whole population, tens of thousands of cases of cancer, it's a very safe vaccine as well. We know this, right? That the side effects are, on the order of 1 in a million. And yet there are still some people who just aren't convinced, that it's not worthwhile. We shouldn't vaccinate young people for it. What do you think would be the best argument to say that this is a safe and effective vaccine?
Oh gosh, I don't know that I have one argument. I have many arguments. This is actually one of my favorite vaccines to talk about because there's so much misinformation out there. HPV related cancers or HPV causes cancers, about 30 to 40,000 cancers a year. And these are highly preventable. And HPV itself is so prevalent in the community. I mean, one of the concerns or one of the myths, I guess, people have or believe is that, it just takes high risk activity to become exposed. So they think if their child or they are sort of low risk, not sexually active necessarily, that or with multiple partners or that sort of thing, that they're not going to be exposed. And 8 out of 10 of us are going to be exposed to this virus at some point in our sexual lives. And we don't fully yet know everything about it. I mean, it takes skin to skin contact. So HPV causes both cancer, but also genital warts, and just skin to skin contact, no actual intercourse required, can transmit genital warts. We also know that HPV causes throat cancers, oropharyngeal cancers, and there's some suspicion that even just deep kissing can transmit that virus and increase the risk of oropharyngeal cancers. So it doesn't necessarily take high risk activity at all. And someone can get exposed the first time they have sex. So, if we can prevent cancer, I mean, what parent wouldn't want to prevent cancer for their child in a safe and effective way? I think one of the things that still I hear actually it comes from the fact that this was rolled out to girls only first. And then it was eventually offered for boys as well. And so there's still this thinking that it's just a virus that is impactful for girls. But really, we know transmission happens between people. And so we have to protect both, and it causes cancers for men as well. So it's really important to vaccinate both our girls and boys. Some people also are worried that, I heard this one the other day, that giving the vaccine is almost like giving them permission to have sex. And that does not happen. There was a great study out of Canada. I can't remember where in Canada, but looking at some hundreds of thousands of girls who were involved in a school-based HPV vaccination program. So they looked at girls who hadn't gone through the school-based program and girls who had and were vaccinated. And they looked at a lot of different measures of things like, pregnancy rates, STI or sexually transmitted infection rates, use of substances around sexual activity, all these markers of sort of high risk activity, earlier onset of sexual activity. And the girls who had gone through the HPV vaccination program had much lower numbers than the girls who had not. And that's probably not the vaccine itself, but the education that goes around giving the vaccine. And we do that in our clinics every day as well. And so there's no evidence at all that this increases sexual activity, earlier sexual activity, risky sexual activity, et cetera. We need to think about it as a cancer prevention vaccine. That's what it is. And that's how we as clinicians should talk about it. And really, who wouldn't want to prevent those cancers, because they're highly, highly impactful. I do female care. I see abnormal pap smears all the time. I'm doing colposcopies and biopsies and things that are painful and invasive because of HPV related disease. And we can prevent that.
Absolutely. And one point to add on to when people say, why do you give it to young people? Little known fact, it's actually, it's more effective when they're before the age of 15. So if you give it at 15, they actually need a whole extra shot versus when you start beforehand. It's only 2. So
which is interesting. I'll bring up a point. I hear sometimes that, the pharmaceutical industry is just in this to make money, and they're just going to keep pushing more and more vaccines. But we actually started out giving 3 vaccines at a younger age, and with additional research and learning over time, figured out what you just said, that if you give it at an earlier age, it's much more effective. And so the recommendation backed off, and we now only give 2 vaccines if we get it started under the age of 15. So, just an argument against you're all in it for the money kind of thing.
Right. Big loss for
sometimes we decrease the number of vaccines you need.
Right. And I think also Gardasil is like one of the most profitable for, I think Merck makes it too. So it's just probably a huge loss that they're taking to vaccinate. Great. Okay. So I think the last two vaccines that can go together, I guess, are the pneumococcal and meningococcal vaccines. The reason I bring them up is that people often have this concern that it's only people who are already ill or who are healthy who need vaccines in the first place. So healthy people don't need vaccines. But with the meningococcal vaccine, meningitis outbreaks can affect young and healthy people and have in the past. So could you speak to the importance of these vaccines and also that kind of concern that maybe healthy people just don't need vaccines?
Bring me back to the meningococcal one. I'm going to talk about how the healthy people don't need vaccines theory, which is not true. I mean, healthy people, yes, are more likely to fare better if they encounter an illness. We're seeing that with COVID, we see that with flu, but it doesn't mean that they're not at risk at all. And, flu, for example, are kids who die of flu every year, of which there are typically, hundreds. And studies have looked at sort of the medical issues that those kids have. Were they healthy kids? Were they kids that were high risk and had significant medical issues? And at least 40 to 50% of kids who die of flu every year are totally healthy kids. No risk factors at all. And so we never really know when we're going to suffer severe consequences of disease. And it's a little bit like playing Russian roulette in my mind. I mean, yes, you're probably going to be okay, but what if you're not okay? And then that child or that adult could have survived more healthily over time. And I, for one, don't want to carry that guilt around of not immunizing my child against something that could be potentially deadly or highly impactful for the rest of their life. So, and we also immunize people who are healthy, like I said, when we were talking about the pertussis vaccine or the whooping cough vaccine before, because we need to create this bubble of immunity, this community immunity or herd immunity to protect people who either can't be immunized. So those young babies can't get certain immunizations, or people who can be immunized but might not mount a good response. So our folks who are immune compromised, they can get immunizations, but they might not have as good of a response. And so they're still at high risk of complications. So it takes all of us looking out for each other and immunizing to protect each other. I think we've gotten very much into this. It's all about me sort of way of thinking in society, and that is not going to serve us well. We need to get back to living as if, and we are in a community. We're not islands. Our vaccine choices impact others and vice versa. So it's equally as important to immunize healthy people. Meningitis, you were asking about. So we have two meningitis vaccines, the meningitis ACWY serotypes, and then there's a meningitis B vaccine. And meningitis, it's one of those illnesses we were talking about. Some are highly contagious, some are highly deadly. This is one of those highly deadly ones. If you come down with meningitis, meningococcal meningitis, which is bacterial meningitis, there are high likelihoods of death and or outcomes that will affect you for the rest of your life. Seizures, brain damage, loss of limbs, all sorts of things. And these occur in close quarters. So there is a contagiousness factor, but we see them more commonly in our adolescents, our college age kids, because they're living in dormitories, or in military because they're living in barracks. And so it's really important that we vaccinate you, and you'll hear about little outbreaks every year, but it's really important that we vaccinate against those, because that outcome of disease is highly deadly and highly impactful for the rest of someone's life.
And I just one thing I wanted to add as well about, healthy people, do they do or not need vaccines? Well, sometimes health isn't so clear cut. I mean, we know in the United States, a lot of people have undiagnosed medical conditions, maybe something like a cardiac condition where it can actually be years in development. People don't know they're unhealthy, right? And we know that viruses, things like that can actually worsen cardiac outcomes, can worsen different health outcomes. So it really is kind of a lot of things that you really can't control or know about in advance. One thing I wanted to touch on, and I had it earlier, but I didn't get to it directly. So you have written extensively about vaccine safety monitoring and kind of these really huge systems that we have both in the United States and then actually abroad. And we have studies all the time that are looking at these surveillance systems. Can you speak a little bit to what we know from these systems to say that vaccines are safe? Because sometimes people are focused on clinical trials or anecdotal events, but we have a huge amount of data. So I wanted to, if you could speak a little bit about that.
Yeah, so there's this very robust and duplicative system of checks and balances that we have in vaccine development. And it starts, even before vaccines go into trial. There's developmental and reproductive toxicity studies that happen in animal models looking for outcomes in pregnancy or, fetal anomalies and that sort of thing that before a vaccine even makes it into human trials. So we start very early in the process as we go along through the vaccine trials, which everybody is kind of becoming more familiar with as we've lived through COVID, but looking at more and more and more people over those different phases of trials. There's data safety monitoring boards that are these independent groups of people that look at research and make sure the numbers aren't being fudged and that the patients are being taken care of and they're safe and treated ethically. Those folks that are participating in the trials. We've got, I think many people are becoming familiar with the vaccine adverse event reporting system, which is this passive reporting system, which takes reports of any potential adverse outcomes to vaccines and investigates those very thoroughly. Nobody's trying to hide anything. All that data is out there for people to see. And so anything that's really a serious, death or those serious outcomes are highly investigated. We want to know if there's big adverse outcomes of vaccines because we don't want to hurt people. And so many more, the Department of Defense, the VA, the Indian Health Service, and more. There's just so many different organizations. There's data mining that happens, looking at our medical records and looking for adverse outcomes that way. It's such a rich network of oversight. And it's not only government funded, there's independent organizations that do this as well. There's, international organizations that do this. So I feel really good. And we in the US have, one of the safest, most effective vaccination programs in the world because of this. And so I feel really confident about the safety of our vaccines. Is every vaccine 100% safe? No, there's always adverse outcomes, but they are exceedingly rare. The things that are really highly impactful in a person's life are exceedingly rare, on the order of, like you said, like 1 in a million things that happen. And when it happens to a person, of course, it's worrisome and it's devastating for that family or that person. But on the balance, the benefit of vaccinating and saving millions and millions of lives, that risk balance decision or risk benefit decision that we have to make with everything we do in life, driving a car, going out for a walk, eating, the balance really highly favors vaccination as a way to protect us individually and as a community.
Absolutely. And actually just heard from Vaccinate Your Family the other day, the way they put it was, we know more about vaccines than a lot of other drugs that you will take. We know more about vaccines than a lot of other things that people just don't even think about, right? That are still safe, but obviously we just know tons and tons and tons about vaccines.
Absolutely. Yeah. Our vaccine monitoring system is the most detailed and intense monitoring system that we have for all medical products.
I just have one maybe extra question that I would ask, kind of, I guess, leave it to you. So I don't think people have a sense of proportion. I know we talked about like vaccines are victims of their own success. So, you don't see a lot of these diseases in your day-to-day life. Besides flu, which obviously is very common, probably one of the most common diseases that we get, what vaccine preventable disease do you either tend to see most often, or do you think is probably most serious among them? So maybe what is something out there that people need to take more seriously?
I think what we talked about before, which is HPV. The two that we still see very commonly, like you said, are flu, and then HPV is the other one. And flu is not benign. It drives me nuts when people say COVID's just a bad flu because it minimizes the flu. The flu is very serious. It can be. It makes you feel like crud for at least a week, and that's if you fare well with it. But we lose tens of thousands of lives every year to influenza, which now unfortunately seems like a drop in the bucket compared to COVID, but it's still really, really important that we immunize against influenza. And then HPV, like I said, it's something that I deal with, doing pap smears and seeing the repercussions of abnormal pap smears on women's physical and mental health, pregnancy outcomes. It can impact pregnancy outcomes. There's an emotional component, even though, like I said, this is a virus that is highly prevalent in the community and takes no high risk activity to acquire. There's still sort of a stigma attached about it and relationship issues. It's a highly complex set of things that happen when someone gets that diagnosis. And so that one is the other one that I think we have a lot of room to improve upon. Our numbers for vaccinating against HPV are not as good as they should be. And hopefully, it is one of our newer vaccines, I guess, relative to other vaccines. It was introduced in 2006, but that's still it's older than many of the people we're vaccinating now. So it's been around a long, long time, and it's highly effective if we give it early and we're consistent about getting it for our kids. So those are the two that I like to focus on because it's what we see in our common practice day to day.
Great takeaway. And obviously, I mean, we want to promote all of them. I mean, they're all very important.
They're all very important. I don't want to see those other ones
in
my practice day to day. So all of them are important.
For sure. All righty. Thank you so much for kind of running through some of these questions. This is super helpful. I think one of the things that you said before that is really important that these vaccines, I mean, these diseases are not as uncommon as we think. And I think a good way of putting a good statistic, terrible statistic, but true, right, is that these diseases still kill tens of thousands of people here in the United States. Now, flu makes up a substantial portion of that, but these other diseases still do get to people. And it's hundreds of thousands of hospitalizations. It's a huge human toll that doctors are trying to tell people, like, look, these are still around, right? And so we do forget about it. It's uncommon enough that it can sneak by us, but these are really, really important. So we would urge you to kind of catch up on these immunizations. It's not really a small thing. I mean, it's a small thing to get vaccinated, of course, but these really, really are worthwhile for us to be investing our time and attention in. So thank you for answering these questions.
My pleasure. Thanks for having me here. It's great to talk to you.
Absolutely. All righty. Thank you.
Thanks, Noah.